Morning, everyone. I am so proud to introduce Dr. Mona Ferguson, who is the fearless leader and executive director of ABCD, and she herself is a model of the Head Start program because she was in Head Start and now she's leading it.
Good morning.
Wait a minute.
Welcome to Bridgeport. Welcome to ABCD, where we serve over 35,000 families every single year with necessary resources for them to just make ends meet. Today, we're going to talk about a really important program that's helping to uplift some of our families out of poverty with quality childcare. We know that childcare is a barrier for some of our most vulnerable citizens here and through Fairfield County and through the entire state. So I'm sure you'll get some great talking points from the governor. I'd like to share with you today that because of the changes that were enacted on October 1st through Care for Kids, it has made access to quality childcare for infant toddlers easier for our parents. Now, it's not easy by any means, but it has made it easier. Moving the rates from 50% up to 65% has increased access for 35% of our families. And we serve over 1,000 families through Fairfield County. Specifically, most of our sites are based here in Bridgeport. So when you think about that working single mom that cannot make it without having their child in quality childcare, think about what Care for Kids means and what these changes mean to our families. Thank you.
Thank you so much, Dr. Ferguson. We appreciate your hospitality, and it was fun meeting some of the kids. I'd like to introduce the mayor of our host city, Mayor Ganem.
Lieutenant Governor, to our commissioner, I can't call you chairman here, but our state representative, Steve Staffstrom, Commissioner, welcome. And Monique, to you, Dr. Ferguson, for all that you do. As you were talking, and you just rattle off with such fluency all the needs that you address to people, to families, to single moms, to children in our community, in our city. I realize that the quality of life for so many depends on so many entities, certainly the state, the federal government, what our departments do, what we do as a city. But here and now, it depends so much on what ABCD has done for decades and what you do continue on the tradition. She's only been there in the last year and has continued to build on that, and we appreciate it. So I'm going to take a liberty, Governor, and give her another round of applause, if that's all right.
Absolutely.
And as you pointed out, and I know that's why the governor, lieutenant governor here, and the commissioner and our state rep, access, opportunity. I mean, if you can't get qualified for the programs, even if you have need, you get left out. And the beautiful children we just saw get left out. So, Governor, to you, Susan, to Lieutenant Governor, thank you for what you're doing, for creating the opportunity for more people, more individuals, more families in our city to access the basic necessities. We're not talking about luxuries here, the basic necessities, single moms, to make it. It makes such a difference in what people can do in the future. You said it, I think. She's a product. She came up through, and look what was produced. Giving on to the next generation. I'll leave it at that. Thanks so much.
Excellent. Thanks. Thank you, Mayor. And now it's my pleasure to introduce the leader of our Office of Early Childhood. She is herself a former preschool teacher, and you can tell when she interacts with kids and adults. And it's our great commissioner, Beth Bai.
Thank you, Madam Lieutenant Governor, and I really appreciate you and the governor being here today. A lot of times, we have press conferences after there's a legislative change, but, our governor has been really clear to us as commissioners that we are to work together across agencies and that we are to make government work better for our constituency and for families, and that our workforce and the critical needs of workforce every agency is to look at. So we're here today to highlight a policy change that was addressing a big problem in Connecticut. First of all, we are short 50,000 infant toddler spaces for parents that need to work, that is licensed spaces, leaving parents unable to work or picking childcare that's not safe or high quality. So we got some additional federal dollars, and we use those to increase the Care for Kids rates for infant toddler care that Monette was referencing. But another thing we did to really help families in the middle class is what happens is the way the benefits have always been structured is once a family moves above 50% of the state median income, they lose all their childcare benefits in one fell swoop. So in October, working with Secretary McCaw and the governor's office, we enacted a policy to address what's called a benefits cliff. And we enacted something that's called graduated phase out, which means families gradually phase out of the benefit so they're not left being unable to go to work. This was, we think, a policy innovation that's been really important for working class families. I have one example to share for you, and I know there's a parent here to speak with you today. This weekend, I talked to a mother of a baby in Fairfield County. Last year, she was making about $37,000, qualifying her for Care for Kids because she was below 50% of the state median income. Over the last year, she's done a super job. She got a raise, a promotion, and her income went to $50,000 a year. This is just 3% above the state median income for a family of two. Before this policy change, she would have lost 100% of her child care support. Instead, she went from paying $241 a month to $344 per month in 2019. If this hadn't happened, her child care would have been $1,600 a month on a $50,000 salary. That would have been nearly 40% of her total income in one day because she did well and persisted in the workforce. Instead, her annual child care costs are $4,100 or 13% of her income. And so until she gets above 65% of the state median income, she will keep her child care benefit and her costs will go up slightly, but she won't face this cliff that drives her right out of the workforce. So we want to point out things that have happened in the past year that are initiatives of the governor and policy changes that are helping working families. And I have other examples as well for families between really $50,000 and $75,000 a year who were losing all of their benefits. So thank you, and happy to answer questions afterwards.
Thank you so much, Commissioner. And now I'm pleased to bring up some parents who have a very powerful story, the Soba family. I guess you got elected to talk.
Yes. My name,
Hang on one second. We're gonna
Yeah,
doing
they
the
have this
adjustment
issue
here.
with me, so we can see you.
Now, the precedent says that Mike Bloomberg should have a box. Maybe we should have a box.
There, she's good.
How's that?
Yeah.
You see
Can
her
you
now?
see her now?
That's much better.
Is that better?
Okay.
so my name is Jessica Soba. I'm a single parent. I don't qualify for health insurance. I don't qualify for food stamps. So when I go to work, I have to work to meet all my ends meet. Food, car payments, car insurance, and everything else in the house. So when it comes to my child and having to get money to pay for daycare, I'm sorry, I get a little emotional when it comes to this.
No, this is a mom speaking.
It has benefited me a lot because I'm able to go to work, do what I gotta do, and have my child get taken care of. And she's in really good hands. If it wasn't for Care for Kids, I would literally be having to pay everything completely by myself. That's a lot more than my salary, and I feel that Care for Kids has helped a lot of parents being able to go to work. It should have a little bit of changes when it comes to their approvals. You know, it's like, for example, you have to work in order to get approved. Something that I don't think it's fair, because some works, they require for you to go to a training, you know, so people who go to training, they should be able to get eligible for this program, because in order for you to get that job, you need to go through training. And if you don't have anyone to watch your kid, how can you go to training? How can you get that job? You know, another thing is, for a single person like myself, it's really hard for us to be able to have our kids taken care of and also do better at our jobs, because we feel like we're in a box. You know, we can't do better, because if we do better, we get more money. If we, you know, if you get a bonus, if you get a raise, and then you fall out, you get all your benefits taken away. And that, to me, it's really a struggle, because it's like people right now in the state, they don't work because they want to be able to stay in that box to be able to get those benefits. And it's not fair because you're basically telling people you can't get better, you can't do better, you can't show your kids to do better because you want to earn these benefits. You know, and I feel like that's putting a knot on our people, on our kids, to be able to show them that they can grow and not feel that they shouldn't be able to do better, to be able to get something that can help them in their life, like childcare.
Thank you, Jessica.
Jessica, good job.
Thank you.
Yeah, wonderful job. Thank you.
Jessica, is that SOBA
SOBA.
from Bridgeport? Yes. Thank you.
Jessica, great job. Thank you so much. And now it's my pleasure to introduce Governor Lamont.
Thank you, Susan. Well, first of all, Jessica, I hope you feel wonderful seeing your kids here at ABCD. You see the love and attention and care that your kids see, and gives you just a little heartwarming feel that you know they're getting the very best opportunity at the starting line of life. And you know that better than anybody else, coming out of Head Start. And what, you know, you've got the heart to be able to do what is required to give these kids that little bit of hope. I just hope all of you can see, all of you out there who are making such a big difference for these kids' lives. And I love seeing their smiles. And somehow we're trying to take a nap. I think we sort of, they were smiling too a little bit. I want to say, Beth, you know, she comes out of early childhood and education. And so again, she has the heart, knows what it does, how important this is. And also, we're trying to leverage every dollar we can. We're going down to Washington, D.C., got additional funding out of Washington, which is not always the case. So what we're doing here at the state level, as you heard, in terms of trying to expand access, make this more possible for more families, and make sure that, Jessica, that as you go up and you keep working, you're not disqualified, or you don't have to pay so much that it doesn't make sense. And I come out of you know, the business world. I'll say this is so important to the business future of the state. I mean, we're short of people. We need, Jessica, we need everybody able to work. Make sure they have the training to work, and also make sure they have the confidence that their child, especially the toddlers in the earliest ages where we have the greatest shortage, you know, they've been taken care of with love and attention, and getting some of the skills. You know, we did some reading and making sure they're ready for kindergarten when that begins. And we need everybody able to work. We need them trained to work. We need to make sure they have affordable health care. We need to make sure they have food. I was, you know, you were telling me about the SNAP program and the fear that people had that their food provided through the feds might be cut back or limited. And the fact that we're now beginning to provide some supplemental food in anticipation of that, but we're not going to let that happen. So I just say, Mayor Ganim, we got to be, you know, proud that you have programs like this here at ABCD. You've got a real partner in the state government to make sure we can continue doing this, working with the feds as best we can. And I just urge everybody to come look at a program like this, see what it means to these kids. It's really key to our future.
Governor, thank you so much. It's great to be back in Bridgeport. I was here on Friday with the mayor and other legislative leaders from Bridgeport, because our whole focus is making sure that we count everyone, even in hard to count areas. And Bridgeport is a hard to count area. You've heard about some of the federal programs, Care for Kids, SNAP, Medicaid. All of these are predicated on how many people, whether they're infants, whether they're seniors, whether they're young people. We need to make sure that we count every person, because that's how we maximize federal dollars here in Connecticut. So we are making sure that we get that complete and accurate count. Bridgeport actually was one of the first city in the state to form a complete count committee, because Bridgeport understands, as the governor and I do, that $11 billion for Connecticut is riding on it. And the governor and I wanted to make sure that as we get ready for this next budget and the new session, that we make sure that the people of the state know about some of the progress that we've already made, raising the minimum wage to $15 an hour, passing gun safety bills. Thank you, Steve Staffstrom and our colleagues in the legislature, making the tuition at UConn more affordable, especially for families that are struggling and those that make less than $50,000. They can send their kids for free, and making childcare more affordable. And I want to thank the governor because he saw the importance of creating a governor's council on women and girls, because the governor understands that women's issues are economic issues and family issues. Our state has more women than men in the workforce, so childcare is critical, especially when employers are struggling to find good people to fill their jobs. Childcare is so important, and we've heard it, Commissioner, as we've worked on the council. And thank you for being creative. Our commissioner has been out talking to providers like this one and saying, how can we make childcare more available? So this is one great initiative that didn't require a law. By the way, we have some ideas that do require laws. And so we are going to be going before the legislature and announcing some ideas that we have that we hope the legislature will see fit to put into law to make childcare more available in every area of the state, particularly in cities where there are small businesses who can take advantage of those changes and make more childcare available. So I want to thank everybody for coming today. And Steve, if you would have a few words as you get ready for the session.
Yeah, thank you, Governor, Mayor, Lieutenant Governor, for being down here today. You know, not to put too fine a point on this, but too often we hear of programs like Care for Kids, like Head Start, as social entitlement programs. They're not. They're economic development programs. It allows us to get folks into the workforce. We know right now in Connecticut, there are thousands, tens of thousands of manufacturing jobs, good paying jobs in a variety of sectors that we need to fill as a state. And we are working every day up in the legislature with the governor, with the lieutenant governor, to figure out ways to get folks trained to take those jobs. Well, job training is great, but if you don't have someone to watch your kids at home in order to go to that training, if you don't have access to high quality, affordable childcare in order to be able to fill that job, having the job offer does you no good, and it does the state no good. So we need to redouble our efforts again this year to protect these types of programs that allow our citizens to be able to be gainfully employed and be able to continue to help us grow and transform the Connecticut economy. So thank you, Governor, for your leadership on this. Thank you, Commissioner Bai. Thank you, Lieutenant Governor, Mayor Ganem, ABCD. Thank you all for all your hard work.
Great, thank you so much. Thank you. Thank you. So with that, we're so happy that we have so many media outlets here, and we'd be pleased to take any questions.
Jessica, how many children do you have? One. Just one. The Governor, were you surprised that this was a problem, these cliffs that Beth was talking about? That people would work hard, get a raise, a $200 raise, and all of a sudden they'd lose this benefit?
I was surprised if we didn't take care of it in this next session, which is what Beth and Jessica and everybody has said how important it is. Look, every single employer, as Steve said, I talked to, one of the things they asked me is before I, come to Connecticut or expand here in Connecticut, I got to find out more about early childhood. I got to find out about the toddler and infant program. I got to find out about daycare. We need everybody able to work, which is what, Steve was saying. And that's what this program is all about.
How do you leverage? How did you get this extra dough out of the feds? It's like 14 million more, or maybe
Yes. Well, we got an additional $14 million. I will also say for a few years, the state's invested in the two-generation approach, which brought this benefit cliffs problem to light and really pressed us to think about what's a solution. So when we got the federal dollars, we worked with Secretary McCall in the governor's office to say we'd really like these federal dollars to be used to address this problem. In the past, the state would generally use the dollars just to expand access. but expanding access as families move into the middle class and they lose 100% of their benefits, they're not going to stay in the middle class, as you said so well. You need a program that has a little bit of a safety net before it drops you off.
I'm a little confused. You told me earlier that there's about 13,000 families in this program, covering about 18,000 kids, but then you said there are 50,000 with infants on a waiting list?
We are short 50,000 infant toddler spaces in the state of Connecticut for all families. So it could be families that could afford it. Even if you offered $500 a week for infant toddler care, you would have a very hard time finding a space. We just don't have the capacity. That's why we have some initiatives and there are a couple legislative initiatives that the Women and Girls Council are taking up to make it easier to expand family childcare, which is a place where families often look. And the Office of Early Childhood has been supporting staff family childcare networks at places like Team in Waterbury, All Our Kin in New Haven.
That's the most expensive because it requires so much attention.
Family childcare is actually less expensive per pupil, per student, if you will, than center-based. Infant toddlers are most expensive, yes, and yes, it's much more expensive than preschool care, and we just don't have the infrastructure in the same way. Connecticut has invested in 3- and 4-year-old preschool since 1996 with school readiness, so we've really been able to expand that, but what that's doing is now shining a light on, well, you're doing pretty well with the 3- and 4-year-olds, but there's nowhere to take the infants and toddlers. So by increasing the rates, we gave parents more purchasing power, and centers can be more stable with the higher rates to keep spots. We've been losing infant toddler spaces over the past 5 years. So we're trying to stem the tide of that loss and work to increase them so families can get to work.
Governor, you have a budget to release on Wednesday. Are you planning on proposing any additional funding for increased access to Care for Kids or any of the early child care programs for actual seats, increase in seats?
Right now, we're leveraging every federal dime we can. We got an increase last session. We're expanding access to folks, not just working families, but also to middle-class families as well. Most importantly, you heard what Beth said in terms of the number of people, some of whom can't even afford to go to work unless we can find more affordable spots, especially for the earliest ages. So we're going to keep working on that, starting with the federal dollars.
I mean, there was legislation, I believe, last year to raise the income eligibility up to what, 75% of the average. Is there any thought about trying to push that again?
Yeah. I think what you're seeing today is that we can do these things administratively as the funds allow. For example, we've just heard we're getting an additional $3 million. We'll have conversations with OPM and frankly the early childhood community and families to say what's the best way to use those dollars. It may be that to increase to 75%, that's a really big fiscal note, but it could be to go from 50% to 55% of SMI. Those are conversations we're having now about how to use those dollars. What we don't want to happen, what happened in other states is they increase the rates very quickly and then the program shut down because of the cost. As you heard Mark talk about how many families there are, we're only serving a certain number.
And there's a couple.
Pardon?
There's no federal hooks on what the income requirements are?
The state is setting that hook. In fact, the feds are just looking to work with states to figure out how to increase it more. We've had sort of historic increases in child care dollars from the feds. And so what we're trying to do is figure out how do we use them to help the most families in Connecticut.
But 2 other points, because child care is so scarce. So one piece of legislation that we will be supporting through the Council on Women and Girls is to try to expand family daycare, particularly in urban areas, to make it affordable for families. That's number one. And number two, one of the things we found through the more than 24 Fortune 500 companies and large employers that are part of our Council on Women and Girls is childcare is a huge issue even for Fortune 500 companies. And so what they are talking about is seeing if several large companies can come together and have access to child care either at one of their sites, one of their company locations, or through some third party. That is how there is a very high level of interest, because when you're competing for employees, you need to have access to high quality childcare. This is something that everyone in Connecticut should be paying attention to.
Do you have a long-term goal of how many seats in Care for Kids and other types of early child care, high-quality programs where we need to be? If you look at Care for Kids numbers, we're way down from where we were a few years ago.
Well, we've picked up a great deal over the past 18 months as we've kept the program open. We expect to get up over 20,000 children. Right now we're at about 18 and a half. So we expect to pick up within current appropriations more than 2,000 more children, another 1,500 families. And, we also have a summer bump, but that's the idea. Is we plan to continue to keep the program open. In the past, under prior administrations, what would happen is when the dollars got to a certain point, they would just shut the program. We have a plan in place to have a wait list if we get to that point, so the programs won't suddenly be shut out and parents won't suddenly be shut out, because it's destabilizing for the industry and it's destabilizing for families. So we're changing how we do that as well, which also was an administrative change.
And you're able to do that within current level of appropriations?
Yes, within the current state and federal appropriations.
And Dr. Ferguson, do you want to talk about the need? Because you were telling us before what the need is. And
Absolutely. So you heard already from my colleagues that the largest need is infantile care. Here at ABCD, we have over 200 children on a wait list. And I'm sure that's the same for some of my colleagues across the state. It's expensive care, as we heard, comparable to preschool care, but it's necessary care. We know the earliest science tells us the earliest we get to a child, the better opportunity and the better chance they have for brain development, for just better quality of life. And this is what we need to be focused on. I could also tell you that through some of the efforts of Commissioner Bai's office and the governor's office, that you can't build a program without really working on that infrastructure. So currently, though these new rules went into effect October 1st, my staff is experiencing a more expedient way through technology, through the use of technology, to approve Care for Kids applications, as well as the redetermination process, whereas it would take 8 weeks to get a process like that completed. They are down to a 1 to 2 week turnover. Granted, yes, we are a very large program and I have directed staff that work on these, but through relationships, through the listening and talking and good communication with providers like myself, the governor's office and the commissioner's office, we've been able to kind of try to eliminate that red tape that affect parents so diversely.
How's that? We good?
Can
Thanks,
we
everybody.
take some questions off topic if folks would like to evacuate the line of fire?
No, hell.